So now let me see the Li2 is the Archean. So that is the sun point. That is Li2 is equivalent to the UB67. Li2 is equal to the UB67. That means Li2 energy depletes the large intestine energy. That energy is moving to the large intestine energy, moving to the urinary bladder. So Li2 is equivalent to the UB67. That means you remember the person who is suffering for the shoulder pain and also all the urinary bladder related disorders. When the person is having the UB's deficiency, you remember UB, urinary bladder, according to the 5 elements theory. Always you keep it in your mind is the 5 elements theory, which is the mother, which is the son. For example, lungs is the mother for the kidneys. Likewise, the large intestine is the mother for the urinary bladder. The urinary bladder is son for the large intestine, according to the 5 elements theory. Always you remember, otherwise you go through once again what is the 5 elements theory, what is Shank cycle, co-cycle, already I have given that explanation. You try to focus and understand so that easily you grasp my concept. Now Li2, once you applied the energy, that moving to the urinary bladder. When the urinary bladder having the deficiency, that particular time the patient feel all the time back pain. So whenever all the women, especially for the women who having the back pain, they do have the urinary bladder deficiency. On that particular time you wanted to treat for the urinary bladder to provide the chi from the colon, so that to be activated, Li2 to be sedated. Li2 to be sedated. Li2 just you apply when you are in confusion mode, you just apply Li2 perpendicular, also it works, and then definitely that's moving the chi to the urinary bladder. So therefore UB related problem, the person who is suffering for the low back pain and the sciatica pain or the leg pain or the leg numbness or the constipation or the nose related disorders or the headache conditions or the shoulder pain, elbow pain, wrist finger pain, or the wrist arthritis, finger arthritis, rheumatoid arthritis, ASLO positive, C reactive protein positive, all the conditions, definitely we can use the Li2 as a sedative point. Right? Li2 is the amazing point because all the till 11 points are the super powerful points, or the very good elegant points. I can say Li2 is it really painful too much? But however the whole needle has been entered to that space, but still you don't feel much pain. That's one way is good, but pain is there. Then acupuncture is not mean that once you insertion of the needle, then the patient should feel the pain all the time till 30 minutes. While insertion of the needle, patient should feel the pain. Of course, that's very, very imperative. He don't feel, then that are also not so good. The patient should feel. After that, the patient feel the numbness, he don't feel anything. Of course, that we can leave it. That's called as a subjective effect of acupuncture. So now we mentioned as a Li2. So Li2 is the sun point, sedative point. That means it having the great ability to get the relief of the constipation as well. Li2, good point for the bowel movements. Then Li3, the point to be known as a sun qian. Sun means again it is the third point. So this is the third point is sun qian. Sun means is the 3, qian means is the shoulder or the space. Now we just apply the large intestine third point, just proximal to the, proximal means above to the head of the metacarpal bone of the second. This is as the first metacarpal bone, this is the second metacarpal bone, this is the third head of the metacarpal bone, this is the fourth head of the metacarpal bone, this is the fifth bone. Right? These are the heads. So now exactly just proximal to the about to the, this is the second metacarpal bone in the depression. You can find the large intestine 3 point. So this is the most very imperative point. Now coming, all the points are really very beautiful point. I just applied the Li3 point, that sedated. Li3 is the, Li2 is the sun point, Li3 is the grandson point. Li3 is the grandson point. So one is the, this point belongs to the wood point, large intestine wood point. Now wood point indicating that going the energy to the gallbladder, right? Because Li3 is equal to the Su Chao in, that is gallbladder 44. Gallbladder 44. When you wanted to use GB44, that receives the energy from the large intestine. If you apply the large intestine 3, that energy is communicating and controlling and regulating to the gallbladder, right? So therefore, when this particular point is the very good point to treat for the headaches, very good point to treat for the headaches. So anything, the shoulder pain, elbow pain, headache, constipation, of course is the related to the pitta get excessiveness, or the gallbladder having the is deficiency. That particular time we can use the large intestine 3, because large intestine is controlling to the gallbladder. When it gets over controls to the gallbladder, when the gallbladder gets the deficiency, so that particular time to communicate each other, to regulate each other, to flow the chi to each other, certainly we can use the 2 points, whether Sanjio 3 to be sedated or the gallbladder 44 to be sedated. Once you sedate that, that also regulating to the large intestine, vice versa. Right. So then further, the fourth point to be known as a Hoku. The most imperative point to be known as a fourth point is Hoku. H-E-G-U. This is Hegu, but the pronunciation is Hoku. H-O-K-U. Hoku. Hoku. It is called as is the great eliminator point, or to be known as a unite together or joining together, or the great valley. Valley means the one mountain and the another mountain joining together. This is the first mountain, this is the second mountain. These two mountains joining together, that's called as a Heku or Hoku. Right pronunciation is Hoku. So what exactly this works and where exactly precisely this point is located, let me see. Exactly you try to find out the proper location, because Li4 for day-to-day clinical practice, normally for clinical acupuncture we use this. But where exactly this point is located? Anatomical location, try to find out the first metacarpal bone and then the second metacarpal bone. This is a second metacarpal bone. This is a second metacarpal bone. From where to where the second metacarpal bone? From here you touch and feel. There are the how many wrist bones are there? 14 wrist bones I believe. So exactly from the wrist bone, from where at the base of the first and second metacarpal bone, from there where it terminates. This is the entire region to be known as a center part of the second metacarpal bone in the depression. That also called as the interosseous muscles, or sometimes we called as a lumbrical muscles on the ventral side, on the dorsal side, also to be known as the interosseous muscles is the big muscles. But here is the Li4, the point is located precisely on that particular location. So exactly you try to find out. In the depression you just apply the lower portion. Now I just applying the Li4, try to find out where exactly. This is the metacarpal bone, second metacarpal bone is the center to be known as a Li4. So this point to be known as a Li4, right? So when try to understand in the another location to be known as a, there is the abducted, that means AB ducted of my thumb and then index finger. When adducted means close together, each other you just close the index finger and then thumb together, then you just trying to find out where the crease, the first and second hand crease ends. The crease ends, from there you just come down, from there you just come to the radial border, you come to the border of the metacarpal bone. Now the crease is here, but you cannot apply on the crease, but where the crease ends, approximately from there you just come towards the index finger. You can find the bone. Inside the bone, that means is the hollow depression, you just apply the needle. That precisely is the Li4 point is the location.
Is it correct, sir?
Yes, exactly correct. So try to mark it all of you. Li1, 2, 3, Arjian, Sanjian, Hoku, Yangsi, Pianli, Venlio, Sialio, Shanglian, Shawuli, Chuchi. Try to understand all these points where exactly is located. So when I'll teach you, try to mark it and try to see in the textbook, try to see in the Atlas of Acupuncture book where acupuncture points are located.
This one is
Correct.
correct, no?
Yes. So once you strongly apply this needle, this having the great ability to be known as a source point of the large intestine. Source point of the large intestine. That means it receives the energy from the lungs. Luvo connecting point. When you wanted to apply combination together, lungs and large intestine works together, the Lichu and then Heiku, Lu7 and K6 together to be activated to treat for the lungs and then large intestine disorders, especially for the common cold and cough and congestion. Together is the very beautiful point to be protocol to treat for the lungs and large intestine, common cold, cough and fever related conditions can be treatable by activating the Lu7 and then K6 points together. And then if you wanted to use bilaterally, certainly the 4 acupuncture points is quite enough to treat for the common cold and cough conditions.
Lu7.
And Lu7 and then Li4. When there is the throat pain is there, that particular time K6 to be included, kidney 6, that is so high. Without throat irritation and pain, we don't want to use the K6 point. So therefore, anything according to the theoretical aspect, that is any whatever etiology, we don't know what kind of the etiology and pathogenesis and causative factors to cause the common cold and cough and any kind of the virus. We know the lakhs of viruses are existing. So which virus is affected, we don't know. So anything the virus is affected, that particular time we can use bilaterally how the Sinarest and cold and CPM tablet to be taken place for to reduce the common cold. So in the same way, if you can do this bilaterally twice in a day or thrice in a day, keep it for 30 minutes and certainly having the great relief. This I am talking about the clinical acupuncture. Not required any kind of the medicine to control, but however common cold and then slightly cough is not your enemies, by the way, that's your friends and then is not the evils. When the patient take the medicine, within 2 to 3 days the cold get vanished. When the patient don't take the medication, he'll be subsided in 6 to 7 days. That is the maximum onset of the action of that disease. The natural phenomena, when there is the accumulation on the frontal cavity called as sphenoid sinus, ethmoid sinus, there are the hollow cavities are existing. Those cavities are required, it is existing here. Whenever you take the shower, slowly, because each and every skin pores having the hollow, so that receives wherever there is a cavities. Sometimes it accumulation on the frontal cavity. The person who subsides the cold by using mechanically or the chemically or synthetically, then you are making the mistake. Tomorrow you develop the sinusitis, you develop the frontal sinusitis, you develop the sphenoid sinusitis, you develop the ethmoid sinusitis, which causing you the pain on the entire region, puffy face, and also you feel there is a accumulation of the water in this particular region. Why is it so required? Cold is the direct. Then why are you telling this the common cold is LU7 and Li4 is good? You just allow, even no acupuncture point also required. Nature has given you as the common cold to eliminate that. Allow them to eliminate. Even don't use any kind of the points. The person is very frustrated. Really he wanted to go for the job. He wanted to use and suppress some amount of the cold and congestion. Even you wanted to use Li4 and Lu7. Both the combination of the points has been recommended. Acupuncture works biofeedback mechanism. Therefore, it doesn't have the major side effects. So due to that reason, if you wanted to use, but it takes a day or 2 or 3, then normally the cold will be subsided without taking any kind of the antibiotics medication or the antivirus medication or any kind of the antihistamine medicines. Naturally will be subsided this without taking medicine also. That is the beauty. Li4 at the same time is a great analgesic point as per the objective effect of acupuncture. There are the two major analgesic points in our body. It works like acetaminophen. It works like a non-steroidal anti-inflammatory drugs. It works as a COX-2 inhibitor. How does it happen? What the endorphins releases through the pituitary hypothalamus, that endorphins will be released by activating the Li4 point. Whether you just insert the needle, even that's quite enough. It's not really quite enough. You try to manually stimulate that particular point, otherwise you just do the electrical stimulation called as a EA acupuncture, or the electricity of acupuncture to be activated, and the person who is suffering for the any kind of the pain in the body, especially the wrist pain, hand pain, elbow pain and neck pain, headache, all the pains to be regulated, the upper extremities to be regulated and free from the pain once you activate the Li4. But just inserting the needle, that doesn't work until you stimulate the vibrations. If you don't have any electricity, use the manual stimulation. I just using now as a stimulation. Try to find out where the needle, what the talking to you. When the needle is precisely comfortable position is hanging under the beneath of the skin, then you see that, yes, okay, this needle is what I says, that will listen, okay. When there is a struck in between the muscular system, then definitely that causes the pain internally without a stimulation also. When the incision is done, that itself is having the pain under the skin. So that time you strongly stimulate, of course, that will going to damage internally, but definitely try to find out what the needle is talking to you, that okay, this is comfortable zone, this also comfortable zone, this is a slightly, this is a very deeper level, I need to withdraw this, now this is okay. When you wanted to stimulate, already there is a deeper level, the chi is accumulated, the deeper level, the needle is struck in between the muscular system. So that time strongly you stimulate, that patient feels terribly. So when I wanted to use now as a stimulation, now I am using the twirling and then twisting method. Twirling and twisting method. However, Li4 is the painful point, but the pain itself is kills to the pain. At the same time, when I wanted to use some other point, those points are not much painful point, whereas in the other points having the much more painful points. When I wanted to stimulate this point, there is the precisely I can do the more vibration. When I can do the more vibration to this particular point, but whereas in Hegu having the some pain point, if you wanted to try to somebody else, you wanted to show them this point is wonderful, once you apply this first point, that is a painful point. You don't do that kind of the job to the initially patient is coming to you directly your analgesic point I told you, so immediately you insert the needle on Li4, that causes the pain. So try to find out when the patient comes to you, then they says that I have the terrible pain, and then the also phobia for the needle, and then inserting the painful points areas, that always is not good.
Sir, if a person is coming for the first time, can we do the acupuncture?
Yes, of course. Why not? Since we are sitting for that purpose, so we can use. That's the reason which point you wanted to use. For example, using the Pai Hui is the very great point, amazing point is DU20. Apply DU20, so they are not seen that you have inserted the needle, and then mention already I inserted the needle. Same kind of the pain you can feel to the other parts of the body as well. Then patient will be comfortable. So hopefully there is the evidence based applications. You can see this works for the radial nerve as well. So you wanted to treat for the radial artery and then radial nerve, where exactly these two fingers, this is the one is the thumb, the second one is the index finger. Together there is the one special nerve to be activated, that nerve to be known as a radial nerve, and radial nerve starts from the special vertebra, that vertebra to be known as a C6 vertebra. This area, these two fingers to be known as a C6 vertebra. Any problem, for example, trigger finger is there, patient feel instant relief, even not even 10 to 20 seconds, the patient feel relief if they are having the trigger finger. Trigger finger, there is the two reasons. One is the nerve compression on the cervical region. The second to be known as there is a ganglion, there is a cyst is there on the palmar region, where the patient couldn't fold the finger precisely. But by the way, there is a very small cyst is there, and there is release the nerve on the cervical region, patient get instantly relief. The patient is complaining, I do have the numbness on my index finger, numbness on my thumb is there, that particular time activate the C6 nerve, instantly patient feel more relaxation. Then Li4 is the point, is the amazing point to treat for the known and unknown etiology of the diseases related to any kind of the problem, when any kind of the pain. You look at about this is the most distal point for the face and then head region. When there is the eye problem, nose problem, mouth problem, lip problem, ear problem, teeth problem, head problem, all the conditions you can use the Li4. Generally it is the distal point for all the facial region. As a supplementary point, as a supportive point to treat for all the sensory organ disorders. At the same time is the combo protocols is there. Those protocols, numerous protocols is there. Whenever you wanted to apply, and then this point is Li4 and then Tai Chung, that's to be known as a C gates. C gates, C means is the 4 gates. The 4 gates to be open once we activate bilaterally Li4 and bilaterally Tai Chung, that is liver 3. The known and unknown etiology of the pain. Anywhere there is the pain is there, that particular time you wanted to activate together. Certainly you can use Li4 here and then bilaterally. You understand this to be known as a valley, and then this is to be known as a great toe, this to be known as a second toe. So midway between liver 3 is located, midway between these two Li4 also located. This according to the mirror image. Then there is the pain on the Li4 region. Without applying the needle on the Li4, apply liver 3 bilaterally, the patient get relief for the Li4 region. Hand pain can get the relief once you apply the liver 3 region. Liver 3 is the point, is the good point to treat for the sinews and then tendons. According to the allopathy acupuncture, so the degeneration meridian or the joint and articulating meridian, joint and then articulation meridian starts from the second toe. So that ascends upward direction where the Xingqian, Tai Chung, liver 2 and liver 3 is there. So both the points are very good point to treat for the tendinitis or tendon or inflammation of the any kind of the heart tissues. Then focus, there are the 4 points to open the 4 gates. Li4 is good point to upper cavity and upper geos or upper extremities. Then the lower extremities to be treatable by using the Tai Chung. So therefore 4 points is directly, indirectly helpful for the entire system of the body to promote the chi and scatter the chi. Li4 is the good point for the reinforcing and the liver 3 to be sedation, or this combination is always is good. When the patient is coming is the pregnancy, positive condition where the gravidex is positive, that particular time till this second trimester, till the 9 months period is not recommended to use the Li4. When you strongly activate the Li4, chances are there to get the miscarriage. We shouldn't use the Li4 during the pregnancy. When you wanted to use to bring the normal delivery, that particular time Li4 to be activated, spleen 6 to be sedated and liver 3 to be sedated. I'll repeat once again, when the normal delivery should happen, so that particular time Hegu to be activated, reinforced or stimulated, that means it's a stronger way we vibrate that towards the chi flow. Whereas in spleen 6 to be sedated, liver 3 to be sedated. Of course is the Chai in, that is UB67 to be done the moxa bilaterally. Oxytocin also releases, uterine muscles get the contraction. Try to find out, there is the head is on the upper direction, malposition of the fetus. So that particular time invert the head to the downwards direction. Certainly the moxibustion works the wonders. So when you wanted to use Li4? At the time of after the 3rd trimester, that means the 9 months completed or 8th months completed, in the 3rd week you can start this procedure. Doing at least 1 week, certainly you can avoid this cesarean section. You wanted to become the gynecology in acupuncture, gynec acupuncture you wanted to practice. Certainly this protocol also works wonders. Archean, the leukorrhea, when the female related problem to be treatable by using the Li2 point is the good point. Li4 is the contraindicated point. When you understand there is the Linku and Tapai, there are the 2 points according to the Tung acupuncture. One is the Li3, the other point to be known as a just proximal to the Li4. These are the 2 points are the very, very imperative point to treat for the numerous diseases. Two most imperative points when the person is suffering for the headache. Within 10 seconds the patient feels the relaxation. Just inserted the needle. The patient says, I do have the pain. Just insert it. Then we are asking them, whether do you have the pain? They says no. On the scalp acupuncture, once the needle inserted, within no time, patient feel more relaxation. I think yesterday one patient is walking like a discrepancy on the hip region. Just inserted very few needles on the scalp. I asked him to walk. I was really shocked. The patient started walking very straight. Discrepancy is not super simple. There is a disc prolapse. PIVD problem, pelvic inflammatory disc disease. So that particular time, you remember how amazing this works timely, but not all the patients, but most of the patients it works wonders. In the same way, this is the Li4, just proximal. You remember when the patient is complaining about the migraine, there is a temporal headache is there on the other part of the body, then used on the opposite side. Now you have the acetaminophen, now you have the anacin tablet, now you have the DOT tablet, now you have the naproxen tablet, now you have the headset tablet with you. The tablet is in your packet. You wanted to give them relief instantly without taking the painkiller, then definitely there is just insert the 2 needles and patient instantly will get relief. Or you wanted to insert the 3 needles, Li4 just above 1 point, just below 1 point. That's what you wanted to do. 3 points on the opposite direction and mark it all the 3 points. In the Zoom, I recommend you mark it and then show me where exactly are you marked that 3 points. Try to learn in the entire class. So what will be the extraction to be taken place? Take something to the home. I am not understanding. The words are going over my head. So all these things will happen, but still there are the certain things definitely you can take to home. Among them, these are the 3 important imperative points. All the points which I told you right now, each and every point is a very, very crucial point. Definitely for the headache, now you have the protocol. Use the Li4, 1 point, the above 1 point, just below 1 point. So Ling Dao and then Sanqian. So these are the 3 points together you can activate and treat for the headache related disorders. It's not mean you just go and then anywhere the person is suffering and then go and insert. It's not good. This is applicable to you or at home. You just try this kind of the modalities.